Hi, everyone, and thank you so much for joining us today for our February Kapnick Strive webinar. My name is Emma Volker, and I am a Wellness Coordinator on the Kapnick Strive team, and I am also joined today by Lexi Judkins, who is my fellow Wellness Coordinator. Today, we are going to be discussing health disparities and understanding your risk. So some key ideas that we are going to hit on today. First, defining health disparities and what they are. And then we'll dive into some examples of health disparities that occur today, especially in the United States. We'll talk about some root causes of health disparities and how we can address those causes, move forward, and close these gaps in access to health. Starting off with the basics here, what are health disparities? The CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health, and these are most often experienced by socially disadvantaged populations. With the term health disparities and this definition by the CDC, the biggest keyword that I want to pull out here is preventable. And the reason this term preventable is important is because a lot of times we hear different terms like health disparities, health inequities, health inequality thrown around, and oftentimes they're used interchangeably when they actually mean different things. And that key component of health disparities being preventable really is the differentiator here. For an example, when we talk about inequalities in health, we're talking about any observable difference that can be verified with evidence. So, for example, an inequality that we would expect to see in nature would be different rates of breast cancer among biological females and biological males. Because of what we know about our human biology, we would expect to see in nature that those biological females are going to have higher rates of breast cancer. And that's not something that is entirely preventable when we're looking at those two groups of biological males versus biological females. Those differences in those rates of breast cancer is something we would expect to see occur and expect to occur naturally. But when we talk about health disparities, that again is when we're talking about differences in the burden of disease, violence, etc., that are preventable. And when they're preventable, that means that they require some sort of intervention to close that gap. In short, socially disadvantaged populations are at greater risk for poor health outcomes and have less opportunities to achieve good physical and mental health, among many other areas of their well-being. So you notice I just mentioned socially disadvantaged populations a couple times. This term is also included in the CDC definition of health disparities. And when we're talking about socially disadvantaged populations, we're referring to those who have been subject to racial or ethnic prejudice, cultural bias, or other biases or discrimination within American society. And it's not based on any certain one individual within this group or their individual qualities. This prejudice, cultural bias is against these groups as a whole. Some examples would be certain racial and ethnic groups, the LGBTQ+ community, women historically, those with disabilities, anyone falling into a low socioeconomic status, and those that have a limited educational background. All of these groups that I mentioned currently experience or have historically experienced inequalities, including segregation, being stripped of their voting rights, gaps in their wages, discrimination socially, and more. These inequalities can be written into law, as it has happened historically, or they can be perpetuated at an individual level. An example would be experiences of racism at the individual level. These inequalities have affected the distribution of resources like housing, food, employment, transportation, and access to healthcare. And all of these factors, these social factors, affect our access to optimal health and well-being. In this next section, we're going to move into some examples of health disparities that currently occur, especially within American society. Starting out with disparities that we see in chronic disease. And again, I want to reiterate here that when we're talking about health disparities, we're talking about preventable differences that we see at a population level. So the first one we're going to discuss is chronic disease. Health disparities in chronic disease prevalence can be seen in rates of obesity, cancer, diabetes, HIV/AIDS infection, and more. In all of those chronic diseases and illnesses that I just mentioned, Black Americans, Hispanic people, and American Indians have higher rates of negative health outcomes and higher rates of prevalence of these diseases. For example, Black Americans are 15% more likely to experience obesity than white Americans and are more likely to develop and die from cancer than any other racial or ethnic group in the United States. To further this point, 15% of Black Americans, 14% of Hispanic Americans, and 18% of American Indians suffer from adult onset diabetes, which is more than twice the rate of the white population living in the United States. When it comes to mental health outcomes, most racial and ethnic minority groups overall have similar, or in some cases fewer actually, reported mental disorders and illnesses than white Americans. However, where we see this disparity occur is that people from certain racial and ethnic minority groups are less likely to seek mental health care or receive mental health care. And this can lead to long-lasting experiences of mental illness that can often develop into some negative health outcomes. The reason that we see this disparity is affected by a number of different factors, the most prominent being access to healthcare. So do you have the budget to afford to pay for a counselor if you are an uninsured person? Do you have, are you in a location where it's accessible for you to see a mental health professional? Do you have a laptop that you can attend teletherapy with, or even just a private space where it will be comfortable for you to speak to a therapist? The other factor is cultural stigma. Do you come from a culture where your family would be supportive of you seeking treatment for your mental health? Those are all huge factors, but definitely not the only ones that influence this disparity that we see in mental health outcomes. Another big disparity that we see in the United States is just having access to quality healthcare. Having access to care and regular care is vital to the overall health and wellness of individuals, and health insurance plays a really key role in this. In the United States, racial and ethnic minorities and low-income populations experience serious disparities in coverage in health insurance, and therefore disparities in access to quality care. So 4 in 10 low-income Americans do not have health insurance, so they're currently uninsured. And half of the nearly 46 million uninsured people in the United States also experience poverty. Just for a benchmark of what that experience looks like, the federal poverty line is about $26,000 for a 4-family household, meaning 2 spouses and 2 children living on $26,000 annually. So you can see how, this financial burden, but also this burden of not having access to care, also being uninsured and not being able to potentially afford quality care, you can see how this leads to disparities in health. About 1/3 of uninsured people in the United States have a chronic disease, and they're 6 times less likely to receive care for a health problem than the insured. So people who don't have access to a usual source of primary preventive health care, meaning don't see a doctor or a primary care physician on an annual basis, those individuals are a lot more likely to end up in the emergency department or in the hospital when they need to seek health care or when they become sick. To reiterate this point, Black Americans use the emergency department at twice the rate of white Americans. And again, that is because of that association that we see with lower income populations not having access to insurance and not having access, therefore, to quality health care. Again, to further highlight this point and the importance of quality health care, 20% of low-income Hispanic youth have gone a year without a healthcare visit, and that rate is 3 times higher than for high-income white Americans. Access to healthcare can also be influenced by the availability of transportation. For example, do you have a way to even get to a doctor's appointment? Can you take time off of work to go to a doctor's appointment? Do you have someone to watch your children while you're there? And also language barriers and making sure that the care that you receive is going to be culturally competent. The last health disparity that I want to cover is differences and preventable differences that we see in rates of violence. So, having a healthy and full life includes being safe from violence. However, we see that multiple socially disadvantaged groups experience disproportionately and equitably high rates of violence. Most often, those groups including women of color and members of the LGBTQ community. One example here is that in the United States, Black trans women have a life expectancy of only 35 years due to high rates of violence against that population. What we see in Canada is that Indigenous women are 12 times more likely than other women in Canada to be kidnapped or murdered. So you can really see that certain socially disadvantaged populations do experience violence at inequitably high rates. And this is really where, when we talk about intervening and reducing these gaps, where this is so important to ensure that both individuals and populations have access to live their fullest, healthiest lives possible. All right, I am going to pass it over to Lexi now, and we're going to talk about some root causes.
Awesome, thank you, Emma. So as she said, we're going to talk about some root causes of health disparities. So if we're looking at root causes, we really need to look at what impacts health. And so this means having the availability and access to high quality education, nutritious food, decent and safe housing, affordable, reliable public transportation, culturally sensitive healthcare providers, health insurance, and clean water and non-polluted air. And a healthy life is supported by several factors, some that I just listed, and we often call these the social determinants of health. And so these factors, as I just said, nutrition, income, housing, and your environment influence your ability to practice these healthy behaviors. And when these factors become unavailable or inaccessible to you, your health in turn decreases. So for example, it's difficult to eat a nutritious diet when there's no grocery store in your neighborhood, or it's difficult to seek medical care if your job doesn't offer health insurance. So looking at some statistics within the United States, we see that 33% of US adults did not see a doctor when sick, or they failed to fill a prescription because of costs alone. 15% of US adults worried about having enough money for nutritious food. 16% of US adults reported they struggled to afford the rent or mortgage. And so living a healthy lifestyle isn't easy or attainable for everyone. And so that's why it's important to note that these factors can contribute to health disparities. So when we are looking at these numbers, the 33%, 15%, 16%, they may look small when looking at percentage, but they actually represent millions of people that are in the United States who are affected by these health disparities. And even thinking today that we have an inflation rate that's at an all-time high of 7%, which only means that costs for things like food, housing, or prescription medications will continue to climb. So just to reiterate what Emma said at the beginning, when we talk about health disparities, it's important to emphasize that the health differences between racial and ethnic groups are not caused by biological factors. Although these are conditions that are associated with racial or ethnic groups like sickle cell anemia or Tay-Sachs disease, health disparities are the result of social inequalities and not biological causes. So it's not the fault of the affected groups. It can be really easy to blame these negative health outcomes like diabetes or heart disease on personal choices or behaviors, but it's often more complex than that. And when the many of the factors that affect health are out of the individual's control, like wage inequality or experiencing racism, it's important to recognize how they have been affected. So let's understand a little bit of risk. So you may be asking yourself, so what's my risk? And the short answer, it doesn't quite work like that. So it's important to note that when we are talking about being at risk for health disparities, we're talking about population level risk. So for example, we know that Black American populations experience chronic diseases at disproportionately higher rates. And we can interpret this to mean that your risk for a chronic disease increases if you are a Black American. However, we can't measure your individual risk. We can't just say like your risk of developing diabetes is 15 or 20% because there are so many other factors that are at play. So being a member of a population or a group that experiences health disparities does increase your risk for certain conditions or outcomes, but it's because of outside factors, not your own health choices and behaviors like smoking, personal diet, or eating habits, which may either increase or decrease the risk. So even if you don't believe that you're immediately at risk from the negative health outcomes of health disparities, some types of health inequalities have obvious spillover effects onto the rest of society. For example, the spread of infectious diseases. We can all relate to this one. The consequences of alcohol and drug misuse, or the occurrence of violence and crime. Additionally, improving the health of individuals in the most disadvantaged communities leads to lower taxes and healthcare costs. Health disparities alone lead to approximately 93 billion with a B in excess medical care costs and 42 billion, again with the capital B, in lost productivity per year, as well as economic losses in premature deaths. So improving the health of individuals in the most disadvantaged communities helps to reduce fear and stigmatization, I can't say this word, excuse me, stigmatization of communities. It translates into more business for that region, and simply, it's also the right thing to do. You know, everyone deserves to have availability and access to high quality education, nutritious food, decent and safe housing, affordable, reliable public transportation, culturally sensitive healthcare providers, health insurance, and clean water and non-polluted air. So kind of looking forward at what can we start doing today? You know, knowledge of health disparities in the most disadvantaged communities helps you and your loved ones avoid the impact of that disparity. Knowledge really is power. So to help address root causes, we can raise public and provider awareness of racial and ethnic disparities in care, work towards expanding health insurance coverage and improving the capacity and the number of providers in underserved communities, and also increase the knowledge base of causes and interventions to reduce these disparities. So implementing evidence-based public health programs that advance health equity can help ensure that all people have the opportunity for long and healthy lives. Public health professionals and community workers can design and implement strategies for reducing health disparities. So I encourage you to start looking for ways that we can help bring more awareness to this topic. So on a final note, as I said, I encourage you to take action and care about everyone's health and not just your own. We are all in this together, and you may never know if there's someone that's struggling. So supporting the well-being of your community in turn supports the well-being of you and your family. So thank you again for everyone that has attended our February webinar on health disparities. We hope to see you at our next one. It's going to be on March 30th from 12 to 12:30, and the topic is on sleep.